everybody, and welcome in. We are so excited you're here today for an awesome demo we have for you. So just going to give everybody a few moments to get situated. So grab yourself some water, cup of coffee, whatever you're feeling, and we will get going in about 2 minutes. Thanks for your patience. If you're just coming in, thank you so much for joining. We're just going to wait about 1 more minute before we get started. Thanks so much. All right, looks like we can get started. So again, thank you so much for joining. We're so excited you're here today. And at this point, I'm going to turn it over to you, Andrew.
Cool, thanks so much. First off, hi everyone. Just want to start off by just thanking everyone really for taking the time out of your busy schedules to tune into this webinar today. So as the title states, this talk today is about ransomware in the healthcare industry. What can be done? So just some brief background. So my name is Andrew Costas. I'm otherwise known as AC, but I work at AttackIQ as a senior cyber threat consultant. So I've been at AttackIQ for 1.5 years. And what that essentially means is that I assist global enterprise-sized customers in building out their security optimization program and practice using the AttackIQ platform, as well as implementing some other key principles such as assume breach, threat-informed defense, purple teaming, as well as operationalizing the MITRE ATT&CK framework. So before joining AttackIQ, I worked as a threat researcher for around 5 years with a main focus on e-crime. So a lot of that meant that there was a big focus, of course, on ransomware. It's been highly prevalent in recent years, along with discovering new families and variants of malware, tracking campaigns, and performing malware analysis. So other than that, other skills I picked up along the way include threat hunting, CTI, incident response, as well as more recently, purple teaming and adversary emulation. So that's a little bit of background about myself. I'm going to just start off with a quick kind of run through of the agenda today. So I'm going to start off with a couple of simple definitions just to accommodate the various different skill levels and job roles that we have tuned into this webinar today, and just to make sure that we're all on the same page for what we're going to talk about for the remainder of the talk. Then going to start off with some of the bad news, so covering some of the key points around ransomware in the healthcare industry. So what some of the data tells us, some of the business challenges, as well as some of the technical challenges faced today. Then on the plus side, we will eventually move on to the good news in terms of what AttackIQ brings to the table. And I'm actually going to talk about some use cases as well. And to wrap up, towards the very end, I'll be showing you some freely available resources for extracurricular activities, which you'll definitely not want to miss out on. So here we go. So starting with the definitions. So let's start off with ransomware. So, because obviously not everyone on this call is necessarily coming from a technical background, but let's just have a quick recap of what we're talking about. So ransomware really is just another category of malicious software. And ultimately, the main thing it does is it infects a computer, by encrypting files on that particular victim machine. So this would typically be users, user profile, documents, desktop, downloads, folders, etc. It really depends on the ransomware author, but the locations of what the ransomware decides to encrypt is typically hard-coded in the ransomware payload. Now, of course, some ransomware can even target network shares or even NAS devices. And as in the case of the WannaCry back in 2017, as well as some other ransomware families, they also can have the ability to self-propagate to other adjacent hosts on the network, particularly if they're vulnerable to certain vulnerabilities. So it's the encryption component which is the real kind of major headache that it causes its victims, because ultimately without the decryption key, it's often next to impossible to recover the encrypted data. So there have been a few exceptions to that, but for the most part, this is the whole business model of ransomware criminals, right? And they know this. This is the bread and butter of what they do. They hold you hostage. They wait for some ransom payment to be transferred to their account, and then ultimately, if they're true to themselves and to their victim, then they may or may not provide the decryption in order for that data to be decrypted and ultimately recovered. So some other kind of characteristics around ransomware is, of course, what I've just mentioned is cryptocurrency. So cryptocurrency is really the digital currency of choice when it comes to not just ransomware, but also just other kind of illicit activities, right? So why cryptocurrency? Well, it wasn't that long ago that regular bank accounts were used, but of course cryptocurrency kind of ups the kind of complexity level when it comes to prosecution and tracking those criminals, right? Because there's certain components in the kind of cryptocurrency kind of ecosystem, such as crypto mixers and crypto tumblers, which have essentially kind of wash the money and make that tracking and that prosecution much more difficult. And then kind of I think what the industry have observed in sort of, I'd say just before the pandemic hit, was this kind of new concept called double extortion. And I've even read one such case of triple extortion, but double extortion has certainly become more common and frequently used by many of the ransomware groups out there. And the reason for that is because asking for X sum of cryptocurrency as a ransom payment is obviously a world of pain. But if you then add a kind of stopwatch to that and you say, well, I'm going to give you 3 days, and if you don't pay up, then I'm actually going to leak and publicly post a subset or maybe an entire organization's data, and that could be anything from financial records to internal blueprints to whatever the case may be, right? But add in that additional layer of extortion with that threat, then suddenly adds that kind of pressure and psychological pressure to the victim. So unfortunately, this often does lead to victims paying up, and of course, there's always the risk that even if they pay, then the data may still be posted publicly or maybe even shared regardless with other criminal groups. And the last characteristic that I just want to mention is ransomware as a service. So again, this is something that we've seen an increase in recent years in terms of popularity, but essentially ransomware as a service enables a very low barrier to entry. So in other words, a criminal can come in with very kind of limited technical knowledge and background, and they have their own ransomware kind of campaign that they can spin up, and with very minimal effort, they can then kind of split the profits with the actual operators that have kind of pre-programmed these ransomware as a service offerings, and then kind of split the profits between the person or the affiliate that runs that campaign and the person that's kind of maintaining the ransomware as a service infrastructure. Now, obviously, there's many other characteristics to ransomware, but these to me are the ones that kind of are some of the more kind of pertinent things. So moving on to the next definition of healthcare. So I'm sure many of you listening today probably already work in the healthcare sector, but for those that don't, I think it's very easy, an easy mistake to make, that we often just only think of healthcare as hospitals and doctors and maybe some of the more obvious things, right? But that said, there are indeed more than just hospitals within the healthcare sector. So we have other elements to the healthcare sector, which can include the various things that I've included on this slide. So dental, clinics, labs, nursing homes, public health, community services, and so on and so on. And the thing is here is it's not necessarily just to highlight the different kind of sort of subsectors, if you like, or different areas within the healthcare sector, but it's also important to consider the fact that within the healthcare sector, there's a couple of terms known as primary care, secondary care, and tertiary care. So primary care, for example, pertains to usually the first point of contact. So if you want to go and visit your doctor or your general practice, or maybe go to the dentist or have your eye examined, that would be classed as primary care. Then you would have secondary care, and this is typically your unplanned care, so elective care, so some kind of accident, emergency care, maybe even mental health care. And then finally, the tertiary care includes things like specialized operations, so that can include things like transplants, neurosurgery, and so on. So there's kind of to summarize, what we've gleaned so far is we've discussed and defined ransomware, which is, as I say, a type of malicious software, and we can apply ransomware to any of these areas within the healthcare sector. And within each of those, not necessarily all of these sectors, but within some of these kind of areas can be potentially further impacted, whether they provide either primary, secondary, or tertiary care, as well as obviously all of the surrounding infrastructure and systems and controls within each of those kind of branches. So now that we've got the definitions out of the way, let's move on and talk about the bad stuff. Let's just get it out of the way. So it doesn't take you very long to find a sea of headlines and news articles pertaining to ransomware. And I'll say ransomware to begin with, because ransomware has been a prolific problem in recent years. It's certainly not going away anytime soon. But at the same time, actually, if you then focus your searches on ransomware and healthcare, you'll very quickly see a lot of results. And sadly, many of these news stories are really quite shocking, and it's quite sad. Particularly when we see headlines such as 25% of ransomware attacks being aimed at the healthcare industry, or another example is a quarter of healthcare ransomware victims are forced to halt operations. These are not good headlines. Although the one thing I would add in the lower left of this slide is clearly the only positive thing I see from this is that the White House must clearly be looking at this and all the various reports around healthcare, because they are actually planning on kind of adding and creating additional guidance around cybersecurity standards and so on, specifically for the healthcare sector. So I think that's at least one good headline that I had to throw in there. Now again, I don't want to bore you too much, but I'm just going to highlight a couple of the things that I find interesting. Is this particular report. So this report surfaced in June. This is the the June 2022 Healthcare Data Breach Report, published on the HIPAA Journal website. And what I found shocking, and I'm sure many of you will, was in terms of the cause of breach, 7 out of the 10 examples shown on this particular report were all kind of caused by ransomware in some way, shape, or form. Now, that doesn't necessarily mean that some ransomware was just dropped on a device and then it just detonated. Chances are that the perpetrators were probably within the environment for quite some time. And that kind of leads me to my next point, really. So this separate report that came, I guess, was co-written by Pomon and Sensinet, called The Impact of Ransomware on Healthcare During COVID-19 and Beyond, kind of highlights some of the impacts that ransomware has had specifically on patient care. So obviously there's things like longer length of stays, delays in procedures, and other factors shown here. And I don't want to necessarily dig into the results, because there's other kind of webinars and talks and blog posts around some of these reports that I'm mentioning. But the reason why I'm mentioning it is really just to kind of highlight that there's other kind of subsets of impacts as well. So going back to my primary, secondary, and tertiary kind of patient level care, there's other kind of things that surround that. So as an example, there could be impact to patient personal information, medical records, whether they're electronic or hard copied, for example. So, if they were stolen, in the case of ransomware, if they were leaked online through double extortion techniques, or maybe even resold on to underground marketplaces, that could then in turn be used for additional kind of monetization, or even things like identity theft. And then, other impacts as well to things like the financial or payment processing systems that, nowadays many healthcare sectors, or the sectors rather within the healthcare organization, clearly, rely on very heavily to accept payment and have their patients pay for treatments, which again, if that was stolen, could be further used for identity theft and monetization. Then, of course, the other impacts, which may or may not seem obvious, are things like disruption to critical medical devices or the control systems that control those critical medical devices, which again could kind of tie in with some of the stats shown here, but ultimately would lead to delay or even cancellation of medical procedures. And then, of course, I know it was shown in the previous slide, or one of the previous slides, about the news headlines, but the potential of having entire closures of departments or entire hospitals or organizations that kind of work in the healthcare sector due to a ransomware outbreak. So not only all the ones listed in this report and the ones that I've mentioned, but ultimately all of that can also play into a huge delay in returning to kind of a business as usual state, right? So if you have a prolonged outbreak of ransomware and your incident response plan, isn't up to scratch, and the eradication, the recovery phases, and restoring from backups, could potentially take, days, weeks, or even months, right? All of that kind of ties into ultimately the patients who are, in the business sense, the customer. And then just one other thing I'd mention from this report is the kind of popular attack vectors. So I mentioned that 7 out of the top 10 in the June 2022 report fell victim to ransomware, but quite often these are kind of delivered through very kind of common methods. So email phishing, cloud applications, IoT devices, and so on. So they're not necessarily using new or novel techniques. They're just using playbooks that work for them. So once that initial access has been gained by the operator, then typically they would either hands on keyboard, through manual commands, they would then kind of explore and kind of navigate their way through the environment, typically over several days or even weeks or months, eventually resulting in them deploying the ransomware, which is often after data has already been stolen, and often the very last phase of a ransomware attack, because that's really the point of no return of detonating the ransomware payload, and then that all they're left with then is the ransom payment to consider. So again, just to kind of bring it home, the Internet Crime Complaint Center, otherwise known as IC3, only in September released an alert based on numerous reports of cyber criminals targeting healthcare payment processors. And I just want to touch real briefly on motivation. So, I'm sure the common question, certainly around the era of the pandemic, was even people in my kind of outside of my work kind of circles, just people that work in other industries, asking the common question of, well, why target hospitals? Why would anyone want to bring down hospital? We're going for a pandemic. Why would anyone want to do that? And I thought this kind of relatively recent interview done by Bleep and Computer, which is a very well known and respected cybersecurity news outlet, but they essentially interviewed one of the groups known as Vice Society. So at the time of this interview, 20% of Vice Society's victims were actually in the healthcare sector. And so this was kind of an extract of that interview. But ultimately the response here, and I've just highlighted the bits that may or may not shock you, but the response was, well, why not? And that's kind of the crux of it, right? There are literally people, human beings behind these attacks that just don't really have the same moral compass that we share. So, that's just as simple as it gets. And regardless of whether it's e-crime, regardless of whether it's, an organized crime group, whether it's a hacktivist, whether it's a nation state, or even a malicious or disgruntled insider threat, right? There's just, unfortunately, people in our world that have that kind of mindset where it doesn't really matter whether it's healthcare, it doesn't matter if it's finance, it doesn't matter if it's energy. They don't care, they don't differentiate between what industry, sector, or vertical that they are targeting. To them, it's just business, it's just another victim, and it's just, for them, hopefully more profit that goes into their bank accounts at the end of the day. So organizational challenges, right? So we're kind of all here, right? So this isn't, I wouldn't say exclusive to healthcare, but just kind of doing my own brainstorming, this is what I see, not exclusive to healthcare, but teams are understaffed, overworked, stress, burnout, mixed agendas, various politics and egos, and lack of vision. The list goes on and on, right? And as I say, this is not meant to be exclusive to the healthcare industry, but they all do play a really big part in when it comes to hampering and hindering the overall state of security in healthcare, and really just in the wider kind of world in general. Then we kind of factor in the technical challenges. So specific now to healthcare, we have problems such as critical legacy systems. So one of my bugbears is that it really frustrates me when our industry makes the very common kind of suggestion to just patch, right? Just apply your patches and the problem will go away. But healthcare in particular has a very real problem in that some of these legacy devices cannot be simply upgraded, because there may be a risk of loss of life. There could be an impact to life in some way, shape or form. And also, behind some of these legacy devices or manufacturers, often take upwards of 3 months, and just to release some kind of patch, whether it's a security patch or otherwise, right? So, you can't just simply patch in certain industries such as healthcare, because there are extra complexities, and you really have to understand the risk and the impact analysis, and there's a lot of work that goes on before just applying a simple patch. So then kind of, in addition to that, there's the ever-changing complex landscape that we all are trying to defend and protect. So, this is complicated by factors such as, new systems or services either being bought into service or decommissioned, cloud projects. We've seen an uptake of cloud projects and working from home, hybrid, cloud and on-prem projects, which all ultimately open up new attack services entirely. Then we have, the inclusion of MSPs and MSSPs. So lots of variables. And again, this isn't meant to be an exhaustive list, right? Then, in relating to that, in terms of the kind of ever-changing landscape, we also have, the security controls. So there's no shortage in our industry, in the cybersecurity industry, that is, of, we have lots of choice, right? It's a bit like when we go to a supermarket. If we want to buy some toothpaste, there's plenty to choose from. So it's the same kind of analogy here for cybersecurity. There's really no shortage of innovation and technologies that are out there. But the key thing here is that the average CISO has over 75 security controls to manage across their very, very complex enterprise level estate, right? So that's a lot of controls, and that's just the average. Some organizations will obviously have less, and some might have much more. But the truth of the matter is that when these security controls fail, which by the way are very costly to the business, in terms of solutioning it and doing the POC and so on, when they fail silently, and there's really no early warning a lot of the times. And even if there is a way of warning if something is about to go down, whether a prevention failed to prevent, or whether there was a capability gap, or even if there was a detection that didn't fire, even if those things are working well, you still need human people and processes to then stay on top of those controls, right? So, even in the best kind of example, if you have a control that fails, and it does do some kind of notification, whether that's through an email notification or some other mechanism, if ultimately there's no one skilled or who has the time available to respond to why that control has failed, then ultimately, how are you going to know at 4 o'clock in the morning if the adversary is actually finding that same failure against one of your controls that could then open the floodgates to other techniques as well, right? And really, why do they fail anyway? Well, any number of reasons. So this could be accidental misconfigurations. It could be some kind of regression in that particular security control or the policy or the rule. New bugs get introduced. Software, unfortunately, is not a perfect kind of answer to anything. So, when new features are brought out, that can sometimes introduce complexity in the form of bugs. And of course, we have, capability gaps and the other things that I've mentioned, such as gaps in processes and people as well. So some other technical challenges is the compliance or the regulatory side of the requirements, right? So as an example, in healthcare, PCI DSS actually requires that controls must be tested around cardholder data environments, or CDE, right? So as well as that, we need to also collect evidence that those security policies are working as they are intended to. And then last but not least, we have, of course, the ever-changing threat landscape. So not only is our terrain that we're trying to protect and defend changing, but so is the world of the adversary and the world that they live in, because new, offensive security tools come out all the time, often for legitimate purposes and by legitimate researchers, but of course they then become weaponized by the cyber criminals, who of course are relentless, and they know that, certainly in terms of ransomware, they know that it's a lucrative business to be in. It's highly profitable, and that's what it is to them, right? It's business. So one final note, and I use this as a good example, I hope, and this is actually an extract taken from the UK's National Health Service, or NHS, only a couple of years ago, and it is still relevant today. But the reason why I highlighted this is because many healthcare organizations, and probably again not exclusive to healthcare, but many organizations are kind of going through this kind of digital transformation kind of phase of business, right? So these digital transformation projects are on the rise. We're seeing an increase of those. And the reason why I took this extract, so this actually came out of the NHS's long-term digital transformation plans and roadmap for the future. So for the next kind of 10 years ahead. So I picked NHS partly because it's kind of, I guess, very well known globally, but it's also one of the largest employers in the world, and also one of the largest employers in Europe. I think it is actually the largest employer in Europe, with over 1.3 million staff. But the purpose of highlighting this is just some of the words that I've highlighted in particular, is because you can really see that, digital transformation projects, while on the surface are good and we need them, but a lot of the verbiage around these types of projects talk about, providing access anywhere, or creating open systems, or, ultimately improving the accessibility of patient records, or by linking data. So it's just an example, and it's not a criticism, but digital transformation projects is just another organizational challenge that essentially opens more doors and increases the attack surface. Right, so the good news is, the bad news is out of the way, so we can now focus a little bit more upbeat and talk about some of the things that we can do. And AttackIQ is ultimately the leading provider of breach and attack simulation. And what we do is continually optimize your defenses, not just through our platform, not just through the testing of your security controls and your assets within your environment, but also through the program and the practices that we provide. And so some of this kind of programming practice is around certain terms such as assumed breach, right? So this really is just a shift in mindset that allows us to go from a more reactive state of waiting for a breach to occur to the assumed breach mindset, which is, let's assume that a breach has occurred. What do we do? How do we test? How do we remediate? How do we close those gaps, right? Then we have other things such as MITRE ATT&CK. So that's the adversarial tactics, techniques, and common knowledge. It's a really, I would say, very well-known, kind of industry-wide known framework that's been adopted in recent years, which is really just a taxonomy to help us and help everyone, really, not just technical people, but non-technical people as well, communicate and understand what a threat actor is doing. So the tactics, the techniques, and the technique implementation, that tool, that software, that adversary group, and all the various other information that surrounds that. But it allows us to communicate that not just within the cybersecurity industry, but across other industries as well. So this kind of is a tried and tested, proven framework that's been around for a few years now, and it's certainly not going away anytime soon. And it's also been increasingly expanded upon, and I think even the latest version has been or about to drop for version 12. So next we'll move on to threat informed defense. So again, this is just a strategy that allows us to focus on known threats, and it kind of ties in a little bit with MITRE ATT&CK, right? Because we're testing known threats and then testing our security controls against these real world known adversary behaviors. So kind of mixing some of these kind of concepts together, we can then start thinking about building a purple team. And while that typically includes members of your red and your blue team, it can of course be extended to other members from, say, your CTI team, or from your remediation team, or your CISA or your incident response team. It really, there's no kind of hard and fast rule. It doesn't have to be a physical team as such. This is just more of a logical team where you are bringing your team members and your key players together in order to improve visibility around this kind of testing using the MITRE ATT&CK framework, applying the assume breach mindset, and using the threat-informed defense strategy. And eventually what that's going to lead to is using a breach and attack simulation tool such as AttackIQ and implementing these practices and programs. Ultimately, it's going to allow you to lay the foundation, and that's going to set you up for a good starting point when it comes to actually testing and validating your security controls, right? That's ultimately what you want to know is, are your controls that you've invested so dearly in terms of time and resource and money, are they actually, doing the job that it was sold to you as? Is there any capability gaps? Maybe you have a security control that's up for renewal and you want to compare it with another vendor, for example, in terms of how it works within your organization. And that kind of leads in ultimately to your cybersecurity readiness. So by being able to test real world adversary behaviors in real time, in production, and of course at scale, not just because we're simulating these threats, right, but we're actually emulating them safely in a controlled manner, actually enables you to constantly improve and test your cybersecurity readiness all the time, all year round. And that leads me to the first of our 4 use cases. So a really common question that I get asked is, MITRE ATT&CK, and for anyone that's vaguely familiar with it, it has a lot of techniques and it has a lot of sub-techniques, and there's lots of good information in there. So where would one start? And I think for healthcare in particular, if you're not sure where to start, you could actually probably start using the top attack techniques calculator, because quite simply, this was a project that came out of the MITRE Ingenuity's Center for Threat Informed Defense. This project came out to benefit all communities, all industries, and it was a collaboration between AttackIQ and other vendors, of which AttackIQ is a founding member and research participant of many of the projects that the CTID have released. But ultimately, the Ransomware Top 10 list is actually a great starting point, because these top 10s and the calculator, which you can use to kind of derive your own meaning for your own environment, depending on your environment's maturity levels. But the Ransomware Top 10 list comes from real world sightings, from real world attacks that were submitted by the research participants for this particular project. So it's kind of a proven way of saying, here's top 10 techniques based on actual data. Maybe now we need to kind of prioritize what do we consider the top 3, or what do we consider the top 5, or maybe we want to just work through the whole top 10. And don't be fooled though, because these 10 techniques may contain other sub techniques, and then within those may contain multiple scenarios or situations or permutations for each. So even if you just start from a single one, you may find that there's different testing modalities to test just a single technique or sub technique, right? But I still think it's worth mentioning, because a top 10 list, and many organizations have their own kind of way of doing this research, but a lot of that comes down to what telemetry they're capturing, where they're getting that information from, what type of information, and how that's kind of distilled and aggregated down. So the second use case is TTP focused testing. So tactics represent the why an attack technique or sub technique, ultimately the reason for performing an action. So in this example, I've just highlighted the exfiltration tactic used in the Attack Navigator tool. Now, the reason why I selected data exfiltration is because obviously in the healthcare sector, one of the key things here is to protect against data exfiltration of not only sensitive patient records and electronic records and medical records, but also, of course, financial information as well. And obviously all of that is kind of fairly paramount, right? So we can use AttackIQ to create atomic-based assessments, which will then test certain TTPs that we're interested in. So as an example, we may not be interested in exfiltration over Bluetooth, so we'll kind of miss that one out, but we might actually be very, very interested in exfiltration over a USB device. So a removable device is a very successful and still very successful, sadly, technique of moving malware, or at least getting malware into an organization, whether that's by accident or not. So there's kind of lots of ways that you can kind of use the MITRE ATT&CK framework, and then go off and use the AttackIQ platform to then go and run those tests and analyze the results. The third use case is control focused testing, and I kind of briefly touched on this on the previous slide. So, data exfiltration in the healthcare sector is very, very very paramount, right? So we can again focus our efforts, and rather than saying we want to focus on data exfiltration, we can focus on all of the possible use cases specific to data exfiltration or in the context of DLP. So, for example, we will have scenarios or permutations that are applicable to endpoint DLP related software or network DLP appliances, for example. So there's different there's very different kind of ways of testing that. We can do that using atomic based testing, where in this example we have just a single scenario but with lots and lots of permutations. So we can say, well, let's exfiltrate some benign, or it could be real, but some kind of electronic medical record over some kind of protocol such as DNS, maybe a or FTP or SMB or whatever the case may be, and let's go and emulate in production, sending that kind of dummy data or even real world data if you're happy enough to supply that for the testing purposes, and that will really test whether your DLP, either on the network appliance level or even on the client side, is actually doing what it says. And obviously that's kind of very key for ransomware. It's very, very key for healthcare. But of course, you can not just focus on DLP, you could also focus on things like what ransomware is good at, right? So ransomware is obviously very good at encrypting files. So you could have other ways of testing, or you could even replay data for things like lateral movement, because a really common thing that ransomware actors do is once they gain initial access, or once they have some kind of access into the environment, they will typically pivot around. So laterally movement through, RDP, WMI, all the kind of common techniques, right? Or even Active Directory related scenarios as well, which again can align to the various controls that you're testing with. And the final example I'm going to cover, and I kind of touched on this earlier when I talked about motivations, is the Vice Society ransomware group. So I'm going to have to kind of speed up a bit because I've clearly talked for too much time, but I'm just going to give this final example. So in short, Vice Society is a ransomware group. I said earlier before that 20% of their victims were actually in the healthcare sector. They've certainly got on the radar of the US CERT because only in September the alert actually came out, and subsequently as part of that alert they were also known to use Zeppelin ransomware. So Vice Society have been known to deploy Zeppelin ransomware, which again a separate US CERT alert came out for that. And subsequently what that meant was that our adversary research team, who are always tracking and kind of monitoring emerging threats, were then able to produce this attack graph. So this is specific to Zeppelin ransomware, but as I said, this has been known to be used by Vice Society. And the purpose of this is really just to highlight the attack chain in response to the public information that was shared in these US CERT alerts. Ultimately, what that means is that we can then now emulate a real-world adversary. So outside of doing control-focused testing or TTP-focused testing, we can actually emulate the full adversary end-to-end. Now, these results are obviously not real world, but we can very quickly see how early on in the attack chain we actually disrupt that particular attacker. So in this case, we've actually disrupted the attack chain at step 12, and then that kind of raises some questions. Well, should we ideally have stopped it at step 0? Or what would have happened if we hadn't have prevented it at step 12? And again, this is just made up lab environment results, so this doesn't reflect true world results, but hopefully you get the idea that you can run these individually, or you can run this in a full attack chain. And the last thing I'll say is that you can of course run not only the pre-built attack graphs, but also you can customize and make your own bespoke attack graphs using your own intelligence, either intelligence collected that's targeting your healthcare organization, or even just the wider healthcare industry if you're part of ISAC groups that share that kind of information. So I think I'm doing okay for time. So a couple of notes, really, just some free resources. CISA, so Stop Ransomware. So if you have been hit by ransomware, and this is just an example, obviously it depends on which country and continent you live in, you may have some kind of similar kind of facility to report ransomware and get additional information. So definitely try and stay on top of a of a kind of outlet that is kind of actively maintained and updated as a kind of source of truth for what to do if you get hit and kind of official guidance. Again, just another kind of great free resource is the AttackIQ Academy. So I think that number is actually slightly inaccurate. I'm sure we've surpassed 34,000 students, but ultimately we have a free academy where you can register. There's no prereqs. Anyone can sign up, and we have a ton of freely available courses. We've even run on occasion some in-person courses as well around the world. So definitely check that out, and also you do have the ability to earn CPE credits and badges for bragging rights, so definitely check out the academy. I touched on this earlier, the CTID as well. There's some great projects there, and I mentioned that AttackIQ are one of the founding research partners, right? So this is just some of the a subset of the research projects on their website. But again, these aren't specific to what we do as a company. These are just projects that sometimes we actively are engaged with. Other times, other companies will also be engaged with. But ultimately, these are here to benefit the entire community across different organizations and different industry verticals. And last slide is this one, which is further resources. So AttackIQ recently released a free trial version. It's a 14-day trial, I believe, and it allows you to do some of the things that I've mentioned. So running an attack graph against the oil rig campaign. You can use the boundary posture management and testing capabilities, which effectively allows you to perform PCAP replays from source to target and actually emulate malicious traffic in order to test your boundaries. And then, of course, it gives you the ability to test your defenses as well as a subset of the controls, such as your next-gen firewalls, your antivirus controls, and so on. And then, of course, you can then visualize that and look at the evidence and hopefully get a good sense of what value the platform brings. So sorry if I've overrun. I'm not sure if I am because I've lost track of time, but feel free to reach out to me if you have any questions. Thank you so much for your time today, and hopefully it all made sense. And yeah, if you've got any questions, just let us know. So that concludes, and I'll hand back.
Thank you so much. And thank you everyone for attending today. Like Andrew said, if you have any questions, you can always reach out to us, and we'll see you next time. Thank you so much.